Dr. Jaffe, this is a two-part question and pertaining to the digestive tract. So, how would you test and assess a patient's digestive health if they were dealing with chronic and severe digestive problems? What course of action would be, next thought about in restoring this digestive health? And is there anything that you would provide as a temporary relief in the beginning of this, whole protocol?
A question that could be asked about probably 1 in 5, maybe even more people who come in seeking relief and benefit. And here is a verbal flowchart of what I recommend based on almost half a century now of coming as a skeptic, but advocating for what I'm going to say. The flowchart starts with a conversation. And it says to the person, digestion is this kind of elegantly complex thing that starts with what you see when you look at what you might eat. It continues with how you put things in your mouth and chew them. It includes how your stomach and then the rest of your intestines digest, assimilate, and eliminate what you're eating. And there might need to be a makeover back to wholeness, back to whole foods. And not just any whole foods that according to the LRA test, you are immune tolerant, you are compatible with from an immunologic point of view. That's probably the single most helpful thing to do when people come to you saying, I need relief because when I eat, I bloat. When I eat, I don't feel good. When I eat, I don't sleep well. When I eat, I can't think in the afternoon, etc. And these are very common comments made by far too many people who then want an external solution to an internal problem. And so we need to remind people that digestion starts with your eyes and mouth, but continues all the way to what you eliminate and how efficiently in the middle you digest, assimilate, and eliminate. What kind of immune defense and repair tolerance or intolerance do you have based on what you're eating and consuming? Are you taking in supplements that provide sufficient amounts given the sea of toxins, of hormone disrupting forever molecules, the solvent residues, the toxic metals, the mold products, the isotopes, all of which consume, they are anti-nutrients, they consume the good nutrients, and essential nutrients you have to take in. Your body can't make them, you have to take them in. So today we need more than we did in the 20th or 19th century, in fact, substantially more. And I will say very clearly that while good nutrition begins in the kitchen and what you consume, essential today is supplementation and intensive supplementation. Supplementation sufficient to keep your urine sunshine yellow based on a super B complex and full mineral complex, a super multi-multi. And omega-3 fats to balance out the excess omega-6. Now, if you're a monk living on the top of a mountain on perfectly whole foods and a complete vegetarian and have been so for a long time, you do not need to supplement with fish oil. And you may hear people say, well, algae is a non-fish source of omega-3. True for DHA. And it turns out you need DHA for brain and body, you need EPA for body and brain, you need both. You need both, you need both. I know there are people who say, you only need EPA. Then there are people who say, you only need DHA. Then there are people who say, well, all omega-3 are the same. Please don't listen to people who are not expert in the subject they're talking about. Bottom line, almost all Americans need omega-3 and omega-6, omega-3 supplementation because of excess omega-6. You reduce the omega-6 when you have more whole foods and less processed foods, less restaurant food, less fast food, and you reduce the omega-6 excess that induces many of the chronic ills that we associate with 21st century living. And then chances are you need other supplements based on 4 self-assessments, and 8 predictive biomarker tests available. You don't have to do 1,000 tests. You might want to do a stool digestive analysis, but I can predict ahead of time, because I used to run the stool digestive lab at the National Institutes of Health. I can predict what it's going to show. If you take a careful history and tell me what I think you're going to tell me in that history, I can predict what that test will show. So I would do that test if the patient says, prove it to me. And oh, by the way, if you want to do a proper stool digestive test, including for parasites, it's 3 stools, at least one of which is purged, and they should be analyzed as fresh as possible. That's a high standard, but there's a reason for that standard. And there are professional parasitologists, people who read the stool analyses, who completely agree with the fact that you can't ship a specimen and look for parasites. And just for completion, there is the Jaffe method of zinc flotation. Turns out that parasites float up in a concentrated zinc sulfate solution, and a lot of the distracting schmutz floats down. So Willadine Zert, wonderful technologist at the Clinical Center of NIH and I, one year we developed and validated and published the zinc flotation concentration method for more accurate parasite detection in stool. So I'm not unfamiliar with analyzing poop. However, given that people really can only do a few things and they want results and they want those results promptly, if you follow the verbal flowchart that I gave, you will achieve results. And if you have any difficulty, bumps along the way, please contact us. Because if you have a question, we have probably heard it before and might even have a very specific and constructive suggestion of how to improve the quality of that person's response, the promptness of their response, and more importantly, the completeness of the response. Because very often what we have to do is take into account their prior medical history and their stress responsiveness, along with eating foods that they can digest, assimilate, and eliminate.
So, Dr. Jaffe, what would you use to provide temporary relief for somebody who's in this whole process of digestive restoration?
Well, now I need to know a little bit, because sometimes people come in and they say, I'm suffering and I'm suffering in my tummy, and you have to solve it now, immediately now. If that's what a person comes in and says, I take a deep breath and point out that we are about to begin a journey. It's a marathon, not a sprint. And yes, I can help you feel better promptly by looking at fiber and prebiotics, by looking at healthy probiotics, by looking at the symbiotics, the recycled glutamine, by helping you eat whole foods that are easy to digest, assimilate, and eliminate, but identifying those to which you already have immune burdens. I can help you undo stressful neurochemicals and stressful neurohormones if you're willing to follow through on some basic health promotion habits and activities. And I think you're worth it. I think now is the time for us to rethink and restart. And yes, I say again, it's a marathon and it will take us more than 20 minutes. But now is the time, and we have helped many other people in your situation to feel and function better. Please do us the honor of allowing us to help you.